Hey everyone, welcome to the Healing Dissociative Identity Disorder course. In this course, we're going to be discussing ways that you can heal dissociative disorders, primarily dissociative identity disorder, also known as multiple personality disorder. So, the overview of this course is going to be we're first going to be talking about signs and symptoms of DID, the conventional way DID is handled, alternative ways of handling DID, trauma therapy, integration, and how long does it take to heal? So, what is dissociation? Dissociation is essentially a detachment from self and/or reality. This is when you are not yourself, when you are someone else or having some sort of experience that detaches you from who you are, almost like an out-of-body experience. And there are several disorders within this category, such as derealization, as in things around you do not seem real, things seem out of place, the things may even seem very dreamlike. Depersonalization is when you're detached from yourself. This is when you are someone else, when you are no longer yourself, you feel like a different person. And there's also identity disorders and multiple personality disorders, and that's primarily what we're going to be talking about in this course, how to handle this when it comes to different personalities, different people that seem like they reside within your mind that you're switching into that are being triggered out in some sort of way. So what is dissociative identity disorder? It's essentially having multiple selves, alter personalities, to deal with trauma. So alter personalities will come about to deal with trauma that you may have experienced within your life. Each alter personality harbors certain memories and traumas, for that is the main reason why these alters exist to begin with. There are going to be people who have varying levels of personalities, different types of personalities. There's certainly going to be a similar theme throughout the people who have these disorders and the different personalities that they have. But primarily what's going to happen is that there's not going to be any set number that someone may have. There could be an average. In addition, these personalities can be very different from one another. You may have individuals, different personalities, that maybe they are very outgoing, extroverted. And then there's another one that's very introverted. There may be ones that's always happy all the time, another one that's always sad and depressed all the time. There could be one, and this is going a bit more on the extreme end, but this is certainly possible as well. Maybe one requires glasses to read, the other one does not. The other one has perfect eyesight. There could be any sort of number of things here that differentiate these personalities that do physically change the body as well. DID forms due to childhood trauma. This is often chronic and repeated abuse, such as physical abuse, psychological abuse, abandonment even, as well as sexual abuse. Generally, the more severe the trauma is, the more repetitive it is in nature, the more likelihood that someone will develop some sort of dissociative disorder, especially dissociative identity disorder, in order to handle and tackle this trauma that they have endured. It often comes from the fact that a child cannot escape, whether that be some sort of physical restraint, or maybe that they cannot leave the home, like they are basically trapped there to endure the abuse. They're not able to fight back because they're too young, they're not strong enough, very, very weak even. And it makes them very weak and numb, to the point where they just accept it as is, and they become numb to the pain. They don't even think about it because they dissociate while they're being abused. And that's essentially what causes the dissociation. They're abused chronically, and they know when they may not necessarily know when it's going to happen, but when it's repeated again and again and again, maybe certain times a day, maybe on certain days, maybe after certain things occur, it could be almost like a ritual even for the abuser to abuse the child. Dissociation will occur with that individual, and what will happen then is that the child will become numb to that. Abusers' psychological tactics. They know how to play the game, the psychological tactics to control another human being, especially one that is very young. Because a child's mind is malleable and impressionable. A child absorbs everything in its surroundings like a sponge. That's why you have to be very careful of the things that are exposed to children because they will absorb it. They may implant words, phrases, or actions to trigger a certain state. Perhaps they want to groom the child in some sort of way to behave a certain way. So what they would do is they know how to manipulate this child into basically training them to behave a certain way because they want them to comply, they want them to obey. Otherwise, there would be a punishment. And that's how you learn to obey. If there's a punishment involved with some sort of action, the abuser will take full advantage of that to say, this is what's right, this is what's wrong. But at the end of the day, the abuser is still going to be abusing the child. Full course will be available to members, so be sure to become a member to the in-depth courses tier to be able to access this course as well as the previous courses I have done as well. So I look forward to seeing you then for the full course of healing your DID.